Good shot there, guys.
All right. In case you're feeling spineless today, we have one for you.
Getting a little hands-on there, Bill.
That's right. You know, this is very interesting, though. I mean, it's amazing what you can learn just by...
It is. We're getting a little anatomy lesson today. Head and neck aches, the most common type of pain conditions. They can be pretty tough to diagnose.
And there are many different types of head and neck pain, so it can be confusing to determine if the pain is serious, some sort of condition, or something just minor. Local chiropractor and author Dr. Jeffrey Stinson is here to break down the differences, tell us about possible treatment options, and it's good to see you. Thank you for coming. We appreciate it. What does it represent when you have a headache? What's going on?
Well, the good news is it's not really your brain that hurts. It's actually, if I can see this.
Yeah, sure.
It's actually, in a high percentage of the cases, it's a compression of the nerves at the base of the skull. This would be the back of the skull. This would be the upper part of the neck. So the research is finding it's a compression of the upper nerves via the atlas vertebra slipping out of place, putting pressure on them. It's important to remember also that a headache is usually a sign that something else is going on.
What are some of the treatments for folks?
Well, it really depends on what your objectives are. If you're simply wanting to treat the symptom or the pain from the headaches, then you can take Advil, Tylenol, prescription medications, or you can treat the root cause of the headache.
So with these underlying causes, I mean, what can the range of issues be, really?
Well, it's kind of like when you have a toothache, for example. Yeah. You can put Orajel on the tooth, you take Advil, Tylenol, and as soon as the medication wears off, the pain returns. So you go to your dentist, you get your cavity fixed, the tooth pain's gone. Very similarly, when the atlas bone, the upper bones in the neck slip out of place, puts pressure on the nerves and causes the headache. So in our office, we use the atlas orthogonal procedure to remove this interference and take care of the headaches.
Can it literally just tension cause that? If you hear tension headache, I mean, just because you're...
The tension headache is a type of headache, but there's an underlying cause from that.
What about, how do you know if it's, say, sinus pressure or this? Is there a way to definitively, determine if this is the cause?
Yes, you would need a thorough evaluation or examination to determine if this is a cause. Research is showing that it is in a vast high percentage, of the cases that it's actually pressure on the nerves that are causing it. Sinus would be in the front, back of the head and neck. Pain in the neck usually is a sign that the headaches are coming from the neck.
Yeah.
Now you mentioned this atlas orthogonal procedure. Is that what it's called? Yeah.
It is.
What is that?
It's a relatively new procedure. There are currently about 250 doctors worldwide using this procedure. It was invented by Dr. Roy Sweat in Atlanta, Georgia, and it's actually using a sound wave to reposition the vertebra off the nerves, allowing the nerves to heal, and the headache goes away.
Are you finding a lot more people